Hi, this is Danielle Wenger. I am working on my video for Dr. Forth's podcast on assessments and testing and the advantages and disadvantages and everything in between. I wanted to talk about the advantages of assessing and diagnosing individual clients. Um, at the 48-second mark, I noted immediately that the one of the advantages, and as a mother and a teacher, one of the main advantages to me is that there is a common language if and when you diagnose a client. So you can say the client is experiencing symptoms of depression, bipolar, just different things that allow for a greater understanding, as well as the ability to do some research and find treatments for that type of diagnosis. At the 1 minute 46-second mark, I did enjoy hearing her say that diagnosing a client and finding a treatment for a client is not a one size fits all. That could be diagnosing a client could be a starting point, but not all treatments will work for a client just because they are diagnosed with a specific disorder or presenting problem. At the 3 minute and 6 second mark, she did talk about ruling out any physical concerns first, as far as, um, getting a physical at the doctor and just asking questions that can check things off of a counselor's list in regards to, is there an underlying condition that could be causing the issue? The disadvantages for diagnosing a client at the 5 minute 30-second mark was that diagnostic categories minimize a client's uniqueness, which I found interesting. I I know in my professional life, I have oftentimes been given paperwork on a student and was told, well, this is what they're diagnosed with. And so these are the presenting problems or behaviors or disabling conditions. And it kind of puts a bad taste in your mouth when you're getting a student you've never met before. Creating those emotional ties and connections, I think, is much more important than understanding and researching a diagnosis right off the bat. Um, and then at the 10 minute 45-second mark, Dr. Forth discussed that cultures may not be taken into account. And that got me thinking about our ethics class and the ACA Code of Ethics and how that could cause undue harm to a client. And so then I went to our library, EBSCO host, and I found an article called Resilience in the Midst of Chaos, Socio-Ecological Model Applied to Women with Depressive Symptoms and Socioeconomic Disadvantage. The article was written by Perez, Wittink, Requea, Harrington, Katz, Juicy Kazwitz, Stone, Bell, and Cerulli. It was written from the Journal of Community Psychology in July of 2019. And it just went on to discuss how having a diagnosis does not necessarily, like Dr. Forth was talking about, take into account an entire individual. It went into depth about, socioeconomic disadvantage is extremely common with women with depressive symptoms, and that even diagnosing them and then deciding to treat them with antidepressant medication or anxiety medication does not necessarily fix the background and the other extenuating factors that are causing the diagnosis that they were given. So I thought this article was really interesting because it tied into what Dr. Forth was saying about it's not a one size fits all with a diagnosis and a treatment, and that we have to really be aware of the client and the client's individual needs.